Hi, I am Dr. Danny Bass, and I am so excited to introduce my patient Lee here today. Thank you so much for filming this video here with us. Lee just finished his MEAW treatment to correct his underbite, and he has got such an amazing story to share. A brief introduction to how we met, and then I'm going to let Lee jump in and tell his side of the story. We met over a Zoom call, and Lee was up in North Carolina. And at the time that I met him, he had been told for several years prior that the only way to correct his underbite was with orthognathic surgery, which is very invasive, very costly, takes him out of work for a long time afterward. Lee was looking for some options that were a non-surgical route to correct his underbite, and he found us. We had a Zoom call together, and I said, you know what, it's going to be really tough, but let's try it. Lee has been an amazing patient. He flew all the way down from North Carolina, where he lives, down to Wellington, Florida here at our office. In 11 visits to the office and 20 months of treatment time, Lee was able to go from where he started with the pictures that I'll share here, where you can see that he's got a pretty substantial underbite, to the pictures that we'll share here at his finish, where we finished him with a really nice occlusion, so much better comfort and function. And so I'm going to turn the floor over to my good friend and patient. Do you want to share a little bit more about your story, my friend?
Absolutely. I appreciate the time, and I'm glad we've made it here, and I'm happy to be here on 20 months later without these metal brackets all over my mouth.
Very good, my friend.
I was in middle school when I first got braces. They actually tried to put the expander plate in my mouth, and I remember to this day, they were trying to put it in there and it wouldn't fit. And they didn't fit, so they didn't expand my palate. From that day on, and from getting braces, that my underbite couldn't be fixed with specifically braces, and that I would need surgery. This is in middle school. I'm not thinking anything of surgery. I'm like, whatever, like my mouth is fine, my teeth are fine. As you progress 5-ish years to high school, I start to notice my underbite a little more. Still doesn't bother me. Everyone I told about the underbite, or like about the fact that I would have to get surgery, was like, oh, you don't need surgery. And like, nobody can tell, like, I don't even know why that bothers you. Well, everyone with an underbite is the only one that is affected by the underbite. So I wanted to get it fixed. When you're told something enough times, you start to pay attention to it more. And ultimately, I had issues eating pizza. I had issues eating sandwiches. You go to bite your sandwich and all the meat slides off your sandwich.
Yeah.
Those little things like that, and I like to eat. I want to enjoy my food. Progress even further. I'm kind of getting out of college. Was always told that I needed to wait till I was done growing. And as a male, I finished growing a little bit later in my 20s, early 20s. I'm 26 right now. In the middle of my college tenure, I was told, hey, you probably should start thinking about this even more. So I was like, I'm not getting braces in college. Fast forward a little bit, graduate college. I get serious about this. I move home to where I start working a full-time job, and I'm like, all right, I'm going to fix this. It was just in my mind. I'm like, I don't care what I'm doing. If I get surgery, I'm getting surgery. I'm figuring out a way to do this. So I started doing research. Actually, I don't think I ever told you this. I found some other way or method of fixing an underbite. I don't even know if this is real. It was one person in California that did like this, some sort of veneer type, like basically veneers, but they were thick, and it helped your mouth or helped your jaw like conform to the way your teeth fit. Moral of the story there is it was really expensive, like really expensive, more expensive maybe in line with surgery. Good thing with surgery, you can get insurance to cover it. Essentially, I saw that and was like, possible, I don't know, doesn't seem very promising. There was like one thing online about it, and I kind of fell away from it, reverted back to surgery, and I'm like, all right, surgery's away. So I actually got some consultation set up with my surgeon, talked to him. He was like, well, first things first, you got to get your teeth straightened out. He's like, before we do surgery, you have to get your teeth straightened out. He's like, I would recommend braces. I was like, I don't want braces. He was like, well, you can do Invisalign too. But I had Invisalign. So got my teeth straightened out, talked to the surgeon more. He's like, do that, talk to me, come back, we can set up a surgery date. I did that. 2 years later, I think, maybe a year and a half later, I finished up-ish with Invisalign, met with the surgeon again, and he's like, all right, you're good to go. And I'm like, what does that mean? Like, I want to know more about this. You're about to break my jaw. And he's like, I'm not breaking your jaw. I'm breaking your jaw 4 times. so he told me I was gonna have to get it broken there to expand it, and then there to actually move it forward. And he was like, and if we get in there and we can't fix it, we're gonna have to break the bottom jaw too. And I'm like, oh, that sounds painful.
Right.
It sounds abrasive. And he told me, I mean, he's like, it is painful. It is a journey. And full recovery is not for like, don't quote me here, but I want to say like a year, because you have to have your mouth wired shut. That's a month to 2 months, depending on how the progression goes there. And then after that, he was talking me through this process, and he's like, then you're probably gonna have to get those braces on so we can control the wire. And I'm like, so like, why did we do this Invisalign in the first place? Well, he's like, to dodge it up front. And he's like, but truthfully, I would probably do braces from the get-go. I'm like, why are you telling me this now after a year and a half of Invisalign? But I didn't say that to him. I'm just thinking in my head. I'm like, and he's like, if you want it to turn out the best way possible, you should do braces. And so ultimately, I'm like, first off, I'm not going to get jaw surgery and my jaw broken without the best practice that he recommends. I'm going to get braces probably right before it, let them tweak it up so then they can wire it shut, then get the surgery, and then they'll be able to wire it shut with the braces afterwards. I leave that meeting and I'm like, I guess I'm getting jaw surgery. So he sends me to a speech therapist where they actually like analyze your speech, analyze your lisp. At the time I had a lisp. I set up a date to get the surgery done. And then randomly one day I'm like, did I do enough due diligence on this? Like, is this really the best way forward? How long? Like, I feel like this is such an antiquated process. Well, there's got to be a better way. Fast forward a week or two, I'm doing a lot of Googling, a lot of YouTubing. I'm like reading a lot of comments too, because I mean, anyone can post anything on TikTok or YouTube, but ultimately I want to see how they transpire into the end result and if they're happy with the end result. Finally, I ran into Angela, who came here, previous customer of yours. I will say she's a very positive person when she talks, so that's one selling point of hers. But also, she was very truthful in what she said and her process and her past of being told she has to get surgery. This was 2 years ago, but I watched video after video. I read all the comments, and then I ultimately discovered what MEAW orthodontics is, MEAW therapy. And so I started to actually Google that. I knew of you because of Angela, but I didn't know if this was a common practice. Remember, I'm in North Carolina, you are in Florida, Wellington, Florida, and I'm like, that's not the most practical and logical thing for me to do, but I could be willing to do that to dodge surgery. I think about 5 orthodontics around the country practice this MEAW therapy, MEAW orthodontics. I found one or two in Texas, 1 or 2 in California, and then 2 here in Florida, 1 being you and then 1 being Dr. Coro in Miami, I believe it is. There was a good testimonial in Texas. That's kind of what sold me on everything. Her progression pictures, and that's ultimately what led me to doing this filming here, is because I wanted other people to know my story and other people to understand where I came from. And I think this is not uncommon, but it's not, I guess, posted a lot on social media, and people don't really understand there is another way to go around this and to fix their underbite. So after seeing that, I was kind of getting sold on the MEAW therapy. Her plus Angela, I was like, this is a solid path forward. And ultimately, it brought me to do more research on MEAW. I found Dr. Coro and realized that he was a professor. And I think he was your professor. And so I was like, I want to talk to this guy. And I want to get down to the source and figure out the truth of the matter and figure out if I'm a candidate. I called his office and was like, hey, how do I talk to Dr. Coro? I want to figure out if I'm a candidate for this MEAW orthodontics, or just tell me what I need to do, ultimately to dodge surgery. I call him. He has a PowerPoint pulled up to go through a few slides, and he tells me a little bit about the practice, a little bit about what he does. Great guy. He was selling me. I was like, I don't need to be sold on this. He was just telling me what he did and how it worked, and I'm like, I'm sold. Like, book my flight tomorrow. It got down to, I told him, I want to do this. Where should I do it? And he's like, Dr. Bass was a student of mine. He was great. You go wherever's easiest for you. And ultimately at the time, there was an Avelo flight that went to West Palm. Wellington's only about 20 minutes west of West Palm. So that's when I called Dr. Bass, said I wanted to set up a consultation. You set up a Zoom meeting. We did the best to look at my jaw. I sent some pictures, I believe. You did not promise me anything besides you said, I think I can get you upright. You said, I think I can get your teeth sitting upright. And I said, you know what? That's good with me. I'm not here to accomplish the perfect smile. I'm here to get over my underbite. And having that true underbite setback of all the struggles I was going over earlier. After that, then I brought up this one more thing of my gum recession in the front that I had prior to getting braces. And actually that kind of came about during Invisalign. And I think it was moving the teeth forward that really expanded that or increased that gum recession. And you said, yeah, that could be a worry. We could hit a roadblock halfway through this. We could hit it at the end of this. I don't know. We may have to pause everything, get surgery, and then resume. And I'm like, geez Louise, I'm like, that sounds rough. Let's hope not.
Yeah.
I honestly thought that it was the Invisalign pulling those teeth forward, and I knew enough about the MEAW orthodontics. I was like, I don't think they're going to be pulling them forward that much. It's more pushing it back. Like, if anything, that's going to help that recession, which I don't know if that's even possible. But it's taking some pressure off that gum.
There you go.
So that was my thought, and I just made a decision. I'm like, you know what? This is the way. This is what I want to do. I don't want to get my jaw broken. That's very abrasive, very disturbing. You don't know, one, how you're going to look afterwards.
True.
I probably have 5 people that I know that got jaw surgery, and it's a flip of a coin of what's going to happen after. So I was also told, like, sometimes people lose complete feeling in their gums.
Wow.
Bottom line is, it's an abrasive surgery, abrasive, invasive, a lot going on there, a lot out of your control, a lot of what ifs, and a lot of fingers crossed and eye hopes. And ultimately I knew with this process, with the braces and with the MEAW therapy, that I could have a little bit more control over it. I could talk to you, have a better understanding of what's going on, where my teeth are going, and ultimately talk to you and see what your thoughts are. Feel like I definitely put a lot of trust in you. I'm glad I did.
Thank you.
Like I said earlier, you do a very good job of under promising, over delivering.
Thank you.
You told me a plentiful amount of times that I'm not sure if we can do that. Like, this is our hope, but we're not sure if we're gonna get there. And I'm like, oh geez, like, are we gonna get there? Like, yeah, that's something that was running through my head. And ultimately, I'm just hoping you're right. Luckily, you were. So we made it. 20 months later, 11 visits later.
Incredible.
We're here. I do not have an underbite anymore.
Woo!
I feel good about my teeth. Think we accomplished everything we set out to do, so I appreciate it.
It is such a pleasure, and I'm so very proud of you. He's had such an incredible transformation, which you'll see from those pictures. And so, Lee, how does your bite feel now compared to what it used to feel like?
Yeah, it feels good, and honestly, it's like I didn't really know what a good bite was supposed to feel like because of the underbite. I mean, it's so weird just going back to what's supposed to be normal. But it feels good, and I feel like I have more control over my bite in the back. And heck, I remember even 4 months ago, I told you, I was like, my teeth are touching in the front, but not in the back, and we fixed that very quickly because I feel like a lot of your hard chewing's done in the back, and you want those teeth to touch to take that pressure away from the front. But my bite feels great. Now I just got these braces off. I'm like, I hope it stays. I'm like, anything can happen. Like, what if I go and eat something hard and knocks out something? I don't know. I'm overthinking it. If we put in some permanent retainers on the top and bottom, and I've got plastic retainers. Because I can tell you one thing, I'm not doing that again.
No.
Not getting braces again. I'm done. If I get punched in the mouth tomorrow, I'll probably say just leave them out.
Well, you're going to do great with your retainers. I have full confidence in you. You've been an amazing patient, and look where you are now. It's just so wonderful. And how's the comfort of like your joints and like your facial muscles like for chewing, like now
Yeah.
maybe compared with before with your underbite?
Yeah, I would say the bite and my facial muscles feel more in line, like everything's connecting better. Before you're getting like a little bit of touch here, a little bit of touch here, and an uneven bite. But I feel like everything feels stable, which is ultimately what I wanted.
Yeah.
Just from eating food and just from, I mean, heck, talking. I feel like everything feels a lot better in how it should be.
Yeah, I'm so glad to hear that. You know, one of the things too that we did a lot of was emailing back and forth. And so Lee, coming from North Carolina, a long ways to come down to Wellington, Florida, and trying to save him time and money, we did a lot of emailing back and forth. So usually the beginning of every month, Lee would email me pictures of his bite, and we would correspond about how to wear the rubber bands and when it was time for him to come back into the office. So we were able to see Lee just every like several months, maybe like every like 3 months, 4 months in between appointments, depending on where we were at with things. But Lee, how did you feel about the email communication?
Actually very solid about that, and honestly I felt like it was always best for me to not leave a stone unturned. If I had a thought in my head, I was going to let you know. Like I didn't want anything to be gray. I didn't want to have like something feel weird in my bite and not let you know. I didn't want you to just go based off of visuals, I guess, and pictures from my cell phone in my mirror, taking a selfie on a Sunday night, just send you then. So hopefully you'd see it early Monday, and then I could switch bands quickly and progress to the next steps. But I felt it went very good. I actually was thinking like there's not much more that would have progressed a lot quicker if I was here, besides like the times when we did like bigger changes. That's when I was like, man, I wish I was there. I could have sped this up even more from 20 months. And I felt like just staying proactive about it, me letting you know and keeping you in the loop. Hey, I'm feeling this, or I'm feeling none of my teeth in the back touching, because I wouldn't say that's uncommon. As we're moving around a lot of the teeth, you're gonna have some weird bites. If I had a weird bite, as long as we had bands going elsewhere that I thought would fix it, I was okay with it. I was like, okay, I think this is moving in the right direction. I thought it went well. I was very shocked you never asked me to redo many pictures. So you're pretty good at judging what's going on within the teeth. I guess you've been doing this for some time.
Yes, sir. Thank you. But that's great. Well, Lee, I'm just overly joyed. I'm so overjoyed with your progress, with your final results. I'm very, very proud of you. You were a wonderful patient, and it was so much fun getting to see that transformation for you. And so,
it was a great decision. I'm glad I went on this journey, even though I had braces for 2 years. I think a funny part of this story too is my fiance now. We were dating at the time for like 3 months, and I was like, oh gosh, I'm about to tell her I'm about to get braces. I was so nervous at the time.
Oh man.
And like that, 20 months later and a proposal later, we are still together. So the braces didn't make me break up with the girlfriend.
Good news there.
And we're still standing.
Hey, so, and you're about to get married too.
Yeah, that's right, in March of 2026.
Well, congratulations, my friend. You're going to have a perfect smile to show off for all those pictures. So, lifetime of memories with perfect smile, and you'll be able to eat all that delicious wedding food with a good functional bite. So, anything else you want to share, or any other questions I should ask?
I'm just fortunate enough to have found you, and I hope other people that are being told they have to get surgery can find this message and realize that they do not have to get surgery. There are other ways, and Dr. Bass is here to help you.
Well, that's very kind of you. Thank you, sir. And so, yes, if you're watching this video and you've been told that you need orthognathic surgery to correct an underbite or an open bite, there is good news for you. The MEAW technique could be a great option for you to have a great functional bite and a perfect smile without having to do orthognathic surgery. So if you're watching this video and that speaks to you, feel free to give our office a call and we can set up a Zoom meeting. Even if you're not in our area, I'd be happy to meet with you and see if you could be a good candidate for the MEAW technique. And if you're able to fly or make your way down to Wellington, Florida, we've got Palm Beach International Airport only about 20 minutes away, so we're conveniently located to a place for you to fly in. And we would love to take great care of you and let your story be the next success story of how you were able to get a great bite without having to do surgery. So we'd love to meet you someday and see how we could help. But Lee, thank you so very much,
Yes,
sir. You're
thank
amazing.
you.
I'm so proud of you.
Yep.
And thank you for filming with us here and sharing your story today.
Awesome. Thank you.
My pleasure.